Hi, my name is Isaac, and I'm a therapist with Sage Neuroscience, and I'm here to talk to you today about our substance use IOP program and how it can be beneficial to you or a loved one in your addiction, treatment, and overall mental health. So, one of the things that's often recommended to people who are struggling with substance use is maybe something like Alcoholics Anonymous, Narcotics Anonymous, right? These are these are peer support groups, and they're really great for accountability. They're great for getting plugged in with other people who are maybe going through similar things. But because they're led by peers, they're really good for peer support, but they're not so great at meeting the clinical needs associated with substance abuse. Right. Substance abuse often co-occurs with other things. And so we call co-occurring disorders, we call them that because it's two things happening at once, right? And so if somebody is, let's say, addicted to alcohol or narcotics, it is very likely that they also have something else that isn't managed. Common things that are associated with that are personality disorders, ADHD, bipolar disorder, depression, anxiety. There's lots of different things that can co-occur with substance use and addiction, and peer support is great for kind of its realm, but it doesn't meet the kind of more clinical needs. PTSD is also another one, right? And so the cool thing about IOP is that because we have a whole clinical team and people who are trained on these things, is we can meet the needs of people in a clinical way with all of these other co-occurring disorders while we're touching on substance use, relapse prevention, and getting your life kind of back in a place where you want it to be. So most people are familiar with the lowest level of care, which is just individual therapy. This is where you go and you talk to a therapist once a week for about an hour. Above IOP, there's also inpatient care. When we're talking about substance use, typically inpatient care looks like some kind of medical detox or some kind of extended detox programs, sometimes 30, 60, 90 days, depending on the person's need. And so IOP, it fills a pretty critical gap between those two things, right? It doesn't really make sense to come out of such a rigid program as an inpatient stay and go immediately to talking to someone for 1 day a week. You're kind of maybe setting yourself up for failure with that. And so the reason why we have the levels of care is because it gives us a way to define kind of what people's needs are and step them up or down through the process. And so IOP is for someone who maybe doesn't need to have an inpatient stay or some kind of medically managed detox, but it's also for somebody who maybe is not having complete success just talking to a therapist once a week. It gives a medium between those two things where you have more care than just individual therapy, but you can still meet the demands of your family and your job and whatever other responsibilities you have going on. So it strikes a nice balance between those two things. So the structure of an IOP, it's a program that is it's 12 weeks long. We have a 12-week long curriculum. The curriculum is cool because it incorporates a lot of different things that you might get out of other types of therapy. We have cognitive behavioral therapy, dialectical behavioral therapy. We have some matrix model put in there, as well as some seeking safety. Doesn't necessarily, you don't need to know all of those things. However, they're all very evidence-based type theories and programs that we incorporate into this to make it very holistic as far as care for you goes. So the curriculum is 12 weeks long. Every week is going to have 3 days, and each of those 3 days is 3 hours long. On top of those groups, you also have potentially individual therapy and medication management. And then if you have to do, let's say, like urinary analysis, we have randomized urinary analysis every so often. So between all of those things, the total time commitment for someone is about 9 to 12 hours per week. Another thing that's really neat about IOP and the fact that it's led by a clinical team is that we are able to address what we call co-occurring disorders in a way that, let's say, peer support groups can't, right? And so if you're someone who's struggling with substance use addiction, but you also have PTSD, bipolar disorder, personality disorders, major depression, anxiety, things like that, we can address those things as a part of the programming. So one of the things that sets Sage's IOP program apart is the fact that we have morning groups, afternoon groups, and a partial weekend virtual group, meaning that it's partly on the weekend, partly during the week, and in the evenings, right? So we have AM, PM, and evening groups, and the reason that we do that is so that we can make these things available to as many people as possible, right? Everyone has different work schedules, things like that. Everyone has a lot of things that are going on in their lives, and so we try to have as many groups as we can to make these things accessible to as many people as possible. A 12-week long program, it feels like a big time commitment, but there's some good reasoning behind that, right? Addiction and substance use, you can think about it as a coping skill, right? The brain copes with stress and all of these different things with coping skills. Everybody uses them, everybody has them, and in the absence of good coping skills or coping skills that kind of serve the direction that you're trying to go in life, the brain will use bad ones, right? If you're somebody who grew up in a family who had substance use, if you have genetic predispositions towards substance use, all of those things can kind of make substance use a primary coping skill, right? And then that comes with a lot of difficulties, right? Things can be, it can get in the way of your job, it can get in the way of families, relationships, right? It causes a lot of devastation for people. And so the 12-week long program is good in that, one, you're getting a lot of therapy and all of these things as you're going through it with the medication management and all of that, but it gives you some time as well to be able to replace these maybe negative coping skills with positive ones. You get the time, the practice, and the information to be able to not only change the way that you cope, but with enough time to incorporate those things into your life in a way that's more sustainable into the future. New Mexico has one of the highest rates of addiction in the country, and it's hard to find someone nowadays who hasn't been affected by addiction in some way or other, right? A lot of us have lost family members to addiction, or potentially we had trauma from adults, parents and caregivers growing up, right? It's such a prevalent thing in our state that most of us have been affected by it in some way or another. With all that being the case, we're trying to provide our community with something that is structured but flexible, provides evidence-based care for the whole person, and meets people where they're at. And for the individual who's struggling with substance use, it often is accompanied by a lot of shame, right? There's a lot of shame that's given to these individuals through society, through their own personal goals and values, maybe through their family members. And it's really a shame because addiction is a disease, right? It's not something that somebody chooses. And I mean, we don't get angry at people for having heart disease, right? Addiction shows up in these behavioral ways that might make somebody act in ways that they don't necessarily want to act, or don't necessarily reflect how they feel they are as a person. And so it's a difficult thing, and it comes with a lot of shame. And one of the things that we want to do here is let people know that addiction is a disease, and although maybe you didn't ask for it, it is something that you have to deal with because it's kind of your life, right? And so we want to come alongside you in this journey and take away some of that shame and just get you some treatment so that you can start living the life that you actually want to live, away from the substances that are keeping you from doing that. If you'd like more information about our substance use IOP programs here at Sage, give us a call, look at our website at sageclinic.org, or scan the QR code.